Okay, Assalamu alaikum. This is a case with our master students. And the main complaint was what from the patient?
Some pain on the
Pain.
buccal mucosa, left side mainly. Lack of retention in some areas. ومmainly lower denture pain.
Okay,
يعني.
let's say with the upper. You remember that I told you about mapping?
Yes.
And it's present in previous videos. Just write down my name, Layla, and denture mapping, and you will find the videos on how to identify and diagnose the denture at the time of recalls. Okay, so this is a case where I told you to put a wash impression, and this is a unique technique that I haven't seen before. I usually use it on my own. By this technique, I do the three objectives that I want. I'm checking the border, and notice that I told you to do border molding, correct? So I'm checking the borders if there are overextensions. I cannot see any, okay? I can't see a bit here. This is overextended. How do I know it was exposed, okay?
Yes.
But even though in your case it's exposed, but I don't have any rubber beyond it, so I might suspect that you simply did not cover it, okay? So one of the criteria I tell you when you do this technique is that you should fold the material to the outside, okay? What did we find? We found areas of pressure on the rugi area. There is an area of a step. Do you see this area? So the good thing about rubber is that you see two things: pressure points and negative. How much negative is there? A lot. This denture is not fitting. If it was correct, I should see all of the impression material wiped away. But taking into account that you said that you mixed a lot and you spent some time in the mixing, this might have set prematurely, meaning that you did not seat it. Because we're not changing the occlusion, we're not changing the teeth, we're not changing anything from the polished surface, I'm satisfying myself with a closed mouth technique. Did the patient close his mouth here?
Yes.
Okay, fine enough. Now, the thickness of the material tells me either the material was set, partially set, or this actually is a denture that is not fitting. Because see how much thick. I want you to do the following. I'm going to stop the video in a moment. I'm going to let you bring a cobia pencil, draw the areas that are exposed with a cobia pencil, and here, please, and take this out. We're going to look at the thickness together, okay?